What is immunotherapy for DLBCL lymphoma? Imagine a treatment that helps your own immune system fight back against cancer. That's what immunotherapy aims to do for diffuse large B-cell lymphoma, or DLBCL, the most common type of non-Hodgkin lymphoma. DLBCL develops when B cells, which normally protect us from infections, turn into cancer cells and multiply uncontrollably. Traditional treatments like chemotherapy can be effective, but immunotherapy offers a different approach by empowering your immune defenses. Immunotherapy is a way to boost or restore your immune system's ability to recognize and attack cancer cells. Cancer cells often hide from the immune system by disguising themselves or suppressing immune responses. Immunotherapy works by removing these barriers, making it easier for immune cells to find and destroy the lymphoma. Unlike chemotherapy, which directly targets rapidly dividing cells, immunotherapy leverages your body's natural defenses to fight the disease. In DLBCL, the immune system relies heavily on cytotoxic T cells, which are specialized white blood cells trained to kill abnormal cells. However, the tumor environment can suppress these T cells, limiting their effectiveness. Immunotherapy techniques aim to overcome this suppression and enhance T cell activity. One of the most notable advances in immunotherapy for DLBCL is CAR T cell therapy. This process involves collecting a patient's T cells, genetically modifying them in the lab to produce a receptor that specifically targets lymphoma cells, and then reintroducing them into the body. These reprogrammed T cells can then seek out and attack the cancer more effectively. CAR T cell therapies like axicabtagene ciloleucel and lisacabtagene maraleucel are approved for patients whose disease has not responded to or has relapsed after initial treatments. Other forms of immunotherapy include monoclonal antibodies and checkpoint inhibitors. Monoclonal antibodies like rituximab attach to specific proteins on lymphoma cells, marking them for destruction by the immune system. Checkpoint inhibitors block proteins that tumors use to turn off immune responses, helping T cells stay active and effective. There are also newer options like bispecific antibodies, which can simultaneously engage immune cells and cancer cells, bringing them into close contact to promote destruction. Epcoritamab, for example, is a bispecific antibody approved for certain relapsed or refractory DLBCL cases, showing promising response rates. Immunotherapy can be used in different ways depending on the stage of the disease. For newly diagnosed DLBCL, it is often combined with chemotherapy in treatments like R-CHOP or Pola-R-CHP. These combinations aim to improve the chances of remission. For patients with relapsed or treatment-resistant lymphoma, immunotherapy offers additional options, sometimes used alongside other medicines to target more advanced disease. Research shows that immunotherapy has improved survival rates and quality of life for many patients with DLBCL. It can lead to durable remissions, meaning the cancer stays away for a long time after treatment. Typically, patients receiving chemoimmunotherapy undergo 6 cycles, each lasting about 3 weeks, with rest periods in between. After treatment, regular follow-ups are essential to monitor for any signs of recurrence. It's important to remember that each person's experience with lymphoma is unique. Treatment plans depend on many factors, including how advanced the disease is, overall health, and personal preferences. Consulting with a healthcare team experienced in lymphoma care is crucial to determine the best approach. Ongoing research continues to bring new hope, with scientists working to develop even more effective immunotherapy options. While immunotherapy has transformed the outlook for many with DLBCL, it is always essential to discuss all treatment options with qualified medical professionals to ensure personalized and safe care.